Well, good morning, Rotary District 7770. Welcome to Conversations with Rotary Action People for Wednesday, June 10th. My name is Donald Hovis from the CWRAP Rotary Club here in Myrtle Beach, South Carolina. Our topic today is in-home senior care with Rotarian Kelly Williams with All Care Living Services and a proud Rotarian of the Somerville Lunch Rotary Club. Good morning, Kelly.
Hey, good morning, Donald. Thanks for having me.
Hey, we're honored you're here. I know you're busy, and I know you're in need right now during this pandemic. So we appreciate you being here to talk about what you have going on. Before we get to your questions that you sent over, we will start with the vision statement of Rotary. Together, we see a world where people unite and take action to create lasting change across the globe, in our communities, and in ourselves. If you're watching here on the Zoom call, thank you for being here. We'd love for you to go to the chat box and tell us where you're watching from and your Rotary Club. And we're also streaming this right now on the Rotary International District 7770 Facebook page. If you're over there watching us, thank you for being here. Please post below the stream in the comments where you're watching from and your Rotary Club. Now for a few key dignitaries that are on the line. So Kelly, you know who's on the line here with us today. Everyone is important. Let's see, past district governor from the Rotary Club of Hilton Head Island. You know him for polio in our district, Mr. Bernie Rydell. Good morning, Bernie. Past district governor from the Rotary Club of Hilton Head Island, Mr. David Terrard and his wife, Susan. Good morning, guys. Thanks again for being here. District Governor-elect from the Rotary Club of Myrtle Beach coming up. Her term, she was just installed on Monday. Her term starts July 1. Miss Pauline Levesque. Good morning, Pauline. District Governor-elect nominee designee from the Sea Island Beaufort Rotary Club. He's waving his hand there. Mr. Bob Gross. Good morning, Bob. Now, this next person has a birthday today. Happy birthday to Mary Gask, who is our public image chair for our wonderful district and a member of the 5 Points Rotary Club. I called Mary before this and sang, and y'all don't need to hear that again. So happy birthday, Mary. Enjoy your special day. You deserve it. There's the mascot. There's the mascot of CWRAP. Our lovely cat there. And last but not least, he runs the stream for us behind the scenes. He's our district communications chair from the Rotary Club of Somerville Evening, Mr. Terry Moore. Thank you, Terry, for all you do. Now, Kelly.
Yes.
You're going to talk to us about in-home senior care, and you have sent over some questions. Before that, I just want you to tell the viewers here real quick, how long have you been in Rotary? Have you ever been past president? You a Paul Harris Fellow? Give us a little snapshot of your Rotary career here real quick.
Okay, I joined Rotary in 2000, so 20 years I've been a Rotarian. I was past president in 2010, and I think I have served in every position except treasurer, I think, in many committees and all that fun stuff. So.
Well, excellent. So I know you and your husband Skip is there in the background. So Skip is also a member of Rotary in Terry's club, the Somerville Evening Club. There he is. He's here for a makeup, but he's here also to talk about what you guys are talking about as well. So your topic is all about aging in place. And so my first question for you is, what type of services are available to seniors in the home?
Okay, well, first, I don't know that Skip signed up to be talking on here. He's just sitting back there to look pretty.
He's the cheerleader.
Yeah, we'll go with that. So there's several different services that are available in the home. You can receive home health care, hospice care, or private duty, what's called non-medical care in the home. So I'll back up a little bit and explain what that is. Home health care is, so someone fell in the hospital rehab and now they're back home, but they need to continue with some therapies in the home. Home health care is your skilled intermittent visits, meaning a therapist, physical therapy, occupational therapy, speech therapy. They will come into your home, provide those therapy treatments for a small, window of time that they do that. But those are your basic services. Hospice care is they come into the home end of life to keep the individual comfortable. And then private duty non-medical care is considered assistance with what it's called ADLs, activities of daily living. So it's things like personal care, bathing, dressing, medication assistance, meals, those types of things. So those are your 3 different types of services that you can receive in the home.
So talk to us a little bit about maybe the difference between each of those.
Okay. So, and I kind of just mentioned it, but the differences, and some of my questions may kind of overlap a little bit. Home health, when they come out, they're coming out to get you back to your functioning level before whatever the incident was that happened. You fell, you broke a hip. Prior to the fall, you were functioning independently in the home. Now you've had the broken hip and you're back home. So those therapies are coming in to get you back up to the highest functioning level that you can get to. Hospice care, they really just come in to keep the individual comfortable. They can provide some palliative respite care to give the family a break, but they offer lots of support to the families, from pastoral stuff to medication maintenance, pain medication, and just emotional support for the family. When they're there, it's usually, you may see the RN, you may see a nurse aide that will come out and help with personal care needs. They have social work services, and but again, they're in the home to keep the individual safe and comfortable, as free from pain as possible, and that individual is wanting to remain in their home until they pass. So that's your home health care, hospice care. Private duty care, we're really just kind of an ongoing service. We provide support to home health and hospice care, and we generally are in the home for an extended period of time. So it would be a nursing assistant that would come in, and we would help with any of those basic ADL kinds of things. So if somebody needs help getting in a shower, getting to the bathroom, so there's, all the personal care things we can do, along with other things. I mean, simple things like taking the trash can to the road, getting the mail out of the mailbox, helping with the pets, helping with meals for the family. We even provide errands and transportation if somebody's unable to drive anymore. So that's your non-medical private duty side.
So who pays for this type of care?
Okay. There are various sources to get these services paid for. If you are eligible and you meet the criteria for home health care or hospice care, you can have one or the other. You cannot have both in the home at the same time. Home health care, again, is to get you better, back to where you were. Hospice is keep you comfortable, palliative type care. Medicare will pay 100% of both of those services, whichever one you may need. Your private duty care, unfortunately, is considered non-medical and is just what it says. It's private. It's private pay, just as if a family had hired, say you had to hire a housekeeper or you had to hire somebody to cut your grass. This is just another level up that you're hiring somebody to come in your home to help you. And generally it's an out-of-pocket expense. There are some small resources out there that will help if a family has a long-term care insurance policy, and if they purchase the in-home care component of it, that may cover if they qualify. There are some small grants, at least here locally. Our office, it's called Trident Area Office on Aging. They offer small grants that will help families have us in their home to help them. But generally speaking, our services are, the non-medical side is private pay, which is what we do.
And, so what other living options are available if we can't or don't want to age at home?
You have assisted living facilities, you have independent living facilities, you have some continuum care places. For an example, here we have what's called the Villages, used to be the Presbyterian home. If you were to go there, they kind of have it's a continuum care. So you could move in an independent living, just as if you were in your own house. And then as you age and you need more help, you could move into their assisted living side where you get a little bit more help. And then they have the skilled care, meaning if you need total care, you have to have a nurse helping you in therapy, and you just are not able to be at home and be alone. So you can kind of, as you age, you can age into the different areas of those facilities. The tough part is, like, an assisted living place is private pay. And even in a nursing home setting, independent living is private pay, and assisted living is private pay. The skilled care, Medicare does cover some of that up to a period, but there are limitations on that as well. It's really, really tough for a lot of families, because if they're not financially able or prepared for their years as you get older and start to need help, there's not a lot of resources that give you all the support that you necessarily need, unless you're able to pay for it.
And obviously right now during this pandemic, can you talk a little bit about, this was not a question you sent over, but this is a question I think is valid for you to at least answer for the viewers, is,
Sure.
As the COVID pandemic, has it affected your business? How has it affected your business? I'm sure you're doing things differently today than you were doing 6 months ago. Are more seniors needing care right now? Can you talk a little bit about that?
Sure. As far as how it affects our business, initially when this all started, and I guess everybody knows PPP now, right? Personal protection, or PPE, personal protection equipment. Sorry, not to be confused with the personal loan. So we already had equipment here for our caregivers, but we were really able early on to ramp up, and we provided all of our caregivers with hand sanitizers, thermometers, gloves, masks. We were not able to get the gowns, but we had everything else. We were able to get everything else in for them. So they were all provided with all of that. We actually, I think we've gotten at least 95% of all of our team, including my office team, went through a COVID-19 national certification. I don't have the certificates in front of me. I could show it to you, but so even though all of our team, and anybody usually in healthcare knows what universal precautions are, and so they all know you wash your hands, right? You wear your gloves, you protect yourself, you protect your patient or your client. But the COVID-19 national certification that our caregivers and team went through just gave them another level of training to make sure that they really are doing everything to keep everybody safe as possible. Through the last 10 weeks, 10, 11, 12 weeks or so, our business has actually been very stable. As a non-medical in-home care company, we actually kind of did get a seat at the table finally with home health care. Our industry historically was kind of considered the redheaded stepchild. We didn't really count because we weren't medical, but we had to fight for it a little bit on a national level, but we are considered essential, so we never stopped business. We had one or two clients that didn't really need us. It was really more of giving them a break. So they stopped and suspended services for a while. And now we are beginning to see a huge increase in the new clients coming in and wanting help, and some that are in facilities. And, we personally haven't had this, but we've had a number of families that we know of that are taking parents out of the assisted livings and bringing them home and just doing the care in the home, as opposed to being exposed potentially to the virus or anything else. But so our industry as a whole, we are really all beginning to see quite an increase in requests for services and help.
And
did that answer your
have
question?
You did, absolutely. Have you known anybody or provided care for anybody that has tested positive for coronavirus?
No, we have not. We have not. None of our caregivers nor our clients have had the virus or tested positive. We do work in several facilities, several homes out in the community. and those homes have had exposures and positive tests. And so we have quarantined. We've had a number of our caregivers that have been tested that work in these facilities. But they've been quarantined for the 2-week period, and in some cases they've been tested. But so far, we've been really, really blessed that we've not had any positive cases.
And one more question regarding the virus. Obviously, as you know, South Carolina is now becoming a hot spot. And in terms of cases, it's one of, I think, 12 or 13 states that are seeing a 30% increase or rise in positive cases. Now, they're saying that's not related to more testing. More testing is being done, but they're saying that's not the reason why we're seeing the rise. In your opinion, I mean, you're in healthcare, you're in home care. I mean, in your opinion, I mean, is this going to be around for a long time? I mean, I think so, but in your opinion, what do you think?
That's a loaded question. No, I don't, I'm not a physician, so I don't know that I can really fairly answer that question. My gut tells me, no, it's not going to be around for a long time, but I can't say that I can really answer that question. Yeah. The cases that we're seeing and hearing about is just, it's in these facilities, and people are in, well, they're isolating all of them. You can't leave your rooms now. If it's assisted living, you got to stay there. If they have cases that are positive, I think my guess is they had some asymptomatic people in there, and then all of a sudden, they all work closely. The nursing aides are all working closely together with each other. They're in close contact with people. So I would say that's the facilities is where we're seeing the uptick on these cases. I like to hope and pray and think that this is going to come to an end soon.
I think we all wish that same thing. So, of the topics you talked about today, in-home care and any of those services, how can someone get more information about in-home healthcare?
Okay. Well, certainly if you are active on the computer, getting online and Googling and doing your homework on stuff, obviously, folks, you can call any of your local offices on aging to get information. Here locally, Trident Area Office on Aging is a resource center for seniors. And it's not just a resource for home care. They offer other resources, and they have food deliveries and get folks, they try to help folks access whatever the resources or things is that they need. And usually, I can speak for us. If anybody calls us, we're going to help them with whatever those questions are, even if it's not for home care. If they need assistance and guidance and other resources, we're going to patch them through wherever they need to go.
And I will say, for those viewers that are watching, thank you again for being here. If you have a question for Kelly here on Zoom, please place that in the chat box for me. And if you're watching over on Facebook, please post a comment below the stream. Kelly, we do have one question, and I would think we may get a couple more to come in from the viewers. And the first one is regarding you and your staff. How many of your staff are CNAs and how many are RNs?
Excellent question. So, because we are non-medical care, I only have one RN on staff, and she does all of our training and supervision for our caregivers. We have plus or minus about 90 caregivers. They are all nursing assistants or nursing aides. Maybe half of them are CNAs, the other half are just nursing assistants that did not receive their certificate, but they have tons of experience. So.
Is there an age limit on in-home care?
An age limit?
Right. So in terms of like, what's the average age of a person you're seeing you providing care for? We'll change the question a little bit.
Okay. Gosh, it's a guess. I think our oldest client, I don't know, Skip, can you help back there?
I can look it up
For
real quick.
some reason, yeah, hey, if you hold, please, we'll look it up and we come back to that question.
Okay. And the next question, what is the age group of most of your clients? So most, I guess
clients,
that's
they're asking clients and employees.
Uh,
From a
th-
from-
both of these questions are referred to as clients. Not
Okay.
your staff was the first.
Okay.
So from a standpoint of an age limit, there is not, because we've got as low as 4 and 5 year old, and we've got, I think, the oldest one is about 97. So it's a wide range of in-home care. It's not specifically for the elderly.
And our clients have a
Good.
pretty big, I mean, our employees are a huge range as well. I mean, you have to graduate, well, there are exceptions, but generally speaking, we don't hire anybody in, much younger than mid-20s, because they have to be able to have experience for us to send them into a home independently to work. But I have caregivers, Skip, I'm asking you again, our oldest caregiver is, and we have had a client, while he's looking that up, we've had a client, I want to think that she was 103 or 106 at one time, was our oldest client. So there's no age restrictions on either way, with the exception of employees. And, obviously they just need to have some experience. So it can't be a 15-year-old or an 18-year-old. And I think, and we have quite a few senior caregivers, a lot, and they might just be going in the home to sit and offer companionship for families. And I think he's got an answer.
78 years old is the oldest caregiver.
78 is our oldest caregiver at this time.
Excellent. We do have a comment here saying happy birthday, Mary. We did say happy birthday to Mary during the introductions, but Mary, happy birthday again. What if a client needs a wheelchair built? Do you do that?
Oh, a ramp. We don't personally build ramps, but we can certainly help families find the resources to get that done. And I think, I could be wrong on this, but I think Trident area, your Office on Aging would be good resources to find those kinds of things as well. So I will say at these times, and it's been this way for many, many years now, any types of care, services, equipment that someone may need and think they need to go to the facility, all of those services are available in the home now. Whatever that equipment is, whatever the medications are, whatever their level of care is, that, you can get hospital beds and lifts and oxygen and, all those things are now available to individuals in their home if they want to stay in their home.
And then the last question I see for you as of right now is, how do you build your business?
How do we build a business? I mean, we've been in business for over 20 years. We opened in 1998. I think it comes down to just like any other business. It's about building relationships, word of mouth referrals, providing just different awareness and educational services to our community is what we do. And then, obviously having your staff that is trained and well educated and knows what to do into providing a quality care.
Excellent. Well, thank you again for your time this morning. We appreciate you being with us and answering some questions and telling us all about what you do and what your company does. So thank you again very, very much. You and Skip are both Rotarians, so I want to comment that we have 2 Rotarians here in the Williams family in the Somerville area. So thank you, family of Rotary. I like that right
And we
there.
were presidents at the same time.
Oh yeah, we both served as presidents the same year in 2010. We both were, what was it, the membership chairs the same year. We just kept having dual roles, doing the same thing in each other's club. So, yeah, we love being Rotarians. We love our Rotarian family. They're our closest friends. Mr. Don Nye is on there. I see Terry's there, but I don't see everybody else. But this is Rotary is our family, and we're very committed and looking forward to getting back to our weekly meetings for sure. Happy birthday, Mary, and thank you guys for having me.
We do appreciate it. Now, for those that are watching today, and this is your first time you've logged on and watched the CWRAP segment, we do these Monday, Wednesday, and Friday at 11 o'clock for the balance of June. starting in July, we will have a special all-club meeting that happens on Wednesdays at noon that will be brought to you by CWRAP. So reach out to somebody in your club. Maybe you haven't talked to them in a while. Reach out to them and say, hey, I watched a really nice CWRAP program this morning. You should tune in to the next one. Because I'll be honest with you, the next program, we're going to have a featured speaker from Live PD, folks. Live PD. Sheriff Lott from Live PD will be on with us on Friday morning at 11 o'clock. We'll hope you'll tune in then. To close this down today, we'll do the Rotary four-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Have a wonderful Wednesday, everybody. Thank you again, Kelly. Thanks again for everybody watching on Zoom and on Facebook. Have a wonderful day. And that's a wrap for Conversations with Rotary Action People for Wednesday, June 10th. Have a great day, guys.
Thank
Bye.
you. See you, Bob.
Thanks, Kelly.
Good